Good morning to some and good afternoon to others. Thank you so much for joining us today for our quarterly meeting of the National Pediatric Vehicular Heatstroke, otherwise known as PVH, Stakeholders Workgroup. I just want to begin to express my sincere appreciation to all of you for being here today, and a special welcome to all of our new members. We're grateful to have your voices and perceptions at the table. We have a full hour ahead of us, so let's dive right in. To start, I'd like to extend a warm welcome to Jan Null. If you're not already familiar with Jan's work, I encourage you to visit him on noheatstroke.org, where you'll find the most comprehensive data on PVH fatalities dating back to 1998. It goes without saying that this year has already felt like one far too many tragedies. I've asked Jan to provide us with a high-level snapshot of 2025 data so far, especially as we're seeing some shifts in the circumstances surrounding these incidences. Following Jan's update, we'll have the pleasure of hearing from two outstanding leaders from Georgia's Department of Early Care and Learning, Brittney Sams and April Rogers, who will introduce themselves and share insights on Georgia's approach to safe child transportation and enforcement practices. And I also, too, would like to welcome all their colleagues that are have participated in this meeting as well. And Jan, with no ado, I'm going to turn it over to you. Hope you're on mute, Jan.
You would think I would have learned that by now. Yes. Good morning, everyone. Alexis, you can go to the next slide. They all know who I am. So as of this morning, this is the where we stand. There have been 15 hot car child deaths so far this year. There's a possible 16th one in the Des Moines area. Not enough information to confirm it at this point. And you can see pretty much pretty broad geographic listing here. Next. Here's just a real quick snapshot of the data off of noheatstroke.org with the with some of the metrics from the different 15 incidents. Next. And this is where we stand so far. Last year we had 39. We're running on about the same pace as that for this time. The average is 37. Next. So this is up to date through through July 15th for looking at this year, last year, and the average. So even though we are on track with last year, we're actually a couple under where the long-term average has been. So I guess if we can take any good news out of any of this, that might be it. Next. This is a really interesting metric. So our long-term circumstances are on the left. About 53% on average are forgotten, 24% gained access, and 22% knowingly left. Those numbers are totally out of the ballpark this year. The knowingly left number is equal with 7 each in the forgotten and the knowingly left category. And then that, of course, squeezes down the gained access. It's way beyond my pay grade to be able to figure out what is going on here. Why this big shift in the metrics like we've never seen. I don't know. I haven't looked at all the years, but I don't think we've ever seen 7 gained access in any single year. So things to ponder, things to think about as far as changing of some of the messaging. Next. And finally, this is one, I don't know that I've shared this one before. So the National Weather Service puts out heat advisories and excessive heat warnings whenever they are an area is in their heat risk categories. And I've gone back over the last 5 and now into the 6th year. And what I find interesting here is that the relatively low percentages of these, well, I don't find it surprising. I can kind of hope this would be the case. The low numbers of deaths that occurred when there was a warning or advisory out, the average being about 15%. And, so I'm not sure if this speaks to good messaging on their part, that, when they put out these advisories, more people are aware, or when it's excessively hot, when at the same time these warnings are out, if people are more aware of the heat and take more in the way of precautions. Anyway, another sort of metric to kind of think about as far as messaging goes, with the overreaching message, I think that it doesn't have to be that hot for one of these PVH deaths to occur. I mean, we've seen them. The first two cases this year were one was 68 degrees, the other was 72 degrees. So again, it doesn't have to be that hot, but anyway, I think this is another interesting metric, and I'm beginning to have some dialogue with people in headquarters at National Weather Service, at least the ones that are left, that about their messaging and how we can kind of collaborate. So. That's actually all I had. Again, Alexis had asked me for a quick update, and any quick questions?
Yes, I have one. This is Uwe.
Hi, Uwe.
In your slide with the numbers there and the ages of the children in the beginning of your thing.
Yes.
I saw one was 9 years old and one was 5, or one was 6 years old. What are the reasons for those children who may be able to get out of it?
Unfortunately, most of these are police investigations, and that sort of detail does not make its way to the surface, typically for quite a while. It may be something as simple as they were left in the car. I know that the case in Galena Park, number 13, there, the child was left in the car while the parent went to work, using the car as childcare, and possibly the child went to sleep and then got overcome by the heat. But I don't have any definitive answers for your question. It's a good one. I don't know it.
Okay, thank you.
Hey, Jan, can I just add something in there?
Sure.
I got that question a lot from people because there have been a couple of children that seemingly would be old enough to open the door. But one of the things that happens when kids get overheated is they can become extremely disoriented and confused. And I don't necessarily think that a 9-year-old would understand maybe that that's what's causing them to feel a certain way, or if they did become disoriented, they may not understand getting out would help.
Yeah, that's a great point for sure. Yeah, that's there are lots of moving parts and variables in this, not with any good outcomes. Thanks, Amber.
Well, thank you, Jan, as always, for stepping in and providing us with information and data. We appreciate you. And I am now going to turn it over to April. And thank you very much, April and Brittney, again, for contributing to today's meeting. We appreciate that.
Thanks, Alexis. We're glad to be here. Good afternoon and good morning to some of you. Brittney and I are going to just kind of talk about the rules in Georgia on the childcare side and what we've done over the years, and kind of walk through the history. But I will introduce myself and then turn it over to Brittney, who will start. I am April Rogers. I am Childcare Services Director of Policy and Enforcement, and I have had the privilege of being here at DeKalb for almost 20 years. I started in the field visiting childcare programs as we call our field staff consultants, as a consultant, and have been in my current role for 10 years next month. And so I oversee our intake processes here, our enforcement unit, and our special investigations. And so when there is a child left on a vehicle, special investigations would do that. And I'll talk a little bit about that later. And I will turn it over to Brittney to get us introduce herself and get us started.
Good morning, everyone. Good afternoon as well. My name is Brittney Sams. I am the Childcare Services Director of Specialty Operations in our administrative unit. And I have been with DCAL just this May, 5 years. I started off in our, as a quality rated assessor, kind of dealing with some special grants that we were issuing out, and then transitioned to childcare services, where I've lived in this role to be able to oversee not only our licensing of programs all over the state of Georgia, but also our exemptions unit, our school age unit, as well as our internal administrative team. So it's great to be speaking with you all today briefly about transportation. Next slide. The quality, the importance of early childhood education has definitely increased in advocacy over the last couple of years. Tying into that is also the importance of not just early environments, but quality early environments. And so throughout tons and tons of research, it has been the benefits kind of always outweigh the cons when it comes to these environments. And so as an agency, a part of childcare services and regulating programs, we like to be able to know that our work is important and what we're doing is important and is adding to these quality environments, as well as continuing to educate providers on how to continue to provide those quality environments. We're working closely with families and programs to ensure that our young learners of Georgia are continuing to be safe and in these high quality environments as well. Next slide, please. So in our state, we have core rules and non-core rules. In our core rules, they are identified by the department that basically are a subset that poses the most greatest risk to children's health and safety. Not saying that the other ones are not important. They're just weighted heavier as opposed to our non-core rules. These rules are evaluated by our childcare consultants at initial licensing, as well as during our licensing studies and monitoring visits, which occur after programs are licensed. And there are 15 categories that pertain to childcare learning centers because our rules are separated by childcare learning centers and childcare families home. Within these core rules, not all of the rules within the category are our specific core rules. And as I stated earlier, that doesn't mean that they're less important. It's just that they are weighted on a greater scale when incidents occur as opposed to when non-incidents are occurring or when they come up. And then we assess these rules by having, the number of core rule categories they are cited within the last 12 months are then assigned that risk level, which attributes to that weight, depending on and determine the compliance of the program. So at each visit, which our consultants are conducting, these rules are being reviewed, and depending on where they fall and which ones are cited, that accumulates a history for the program, and then we're able to gauge from there the risk level associated with that program. Next slide, please. So effective transportation and licensing. We view there are many components to this, but of course, first importantly is vehicle safety and maintenance. That involves the actual mode of transportation that the center or childcare program will be using, adequate staffing, who will be driving the children, who will be picking them up. Are there additional individuals that will be associated with riding with the driver? How many students are they picking up? Ensuring that they are not only in ratio inside of the classroom, but outside and on the vehicle as well to actively, safely transport children back and forth. Proper documentation. Are they ensuring that there are permissions from parents when children are being picked up and dropped off during center activities? Do they have these special permissions on site for each child that will be participating? Are checklists being used? Things like that. And then, of course, the vehicle evaluation procedures. Are they ensuring that the vehicles are up to code? Are the proper individuals who are executing transportation, do they have their proper trainings and listings that they need to have on site, and all of those things? And so for us, those are kind of our markers and our things that we're looking at and assessing in order to determine that transportation is effectively being carried out by the childcare program. Next slide, please. As I had mentioned, for our initial licensing visits, as well as our monitoring visits throughout the year once a program becomes licensed, we are looking at certain things have more heavily weighted than others in assessing an accurate visit, an accurate occurrence for transportation for child care programs. For our passenger checklist, this is basically ensuring that the individuals are listed, they have everything there. It's separate and should be housed for each vehicle, meaning that if there are 2 buses, each bus has to have this checklist. One cannot be used for all. We're making sure that children's names are listed accurately and individually. Sibling groups can't be combined together. Each child has to be specifically labeled with first and last name to be able to be checked off, each as an individual. And then, of course, ensuring that when they are loading and unloading, all of those children are accounted for as well. And all of these are done with checklists that either we have kind of mock on our website that programs can use, or they create their own. However, there is a standard, and this the rules guide what specific information that they have to have on them in order for us to accurately deem them able to transport. Next slide, please. When it comes to the actual vehicle, they have to also make sure that there is a first check. That means before children are getting loaded, that all of the health and safety requirements that are there, that they are maintained. There's a second check when it happens, of course, when you're unloading and unloading the vehicle, to make sure that nobody has been left, to ensure that all children have exited the vehicle, and then also making sure that this is done physically. It's not just a telephone call. It's not just verifying, loosely going in, checking every seat, every under seat, just to make sure that they are in compliance and that no child is left behind. And we do have logs that indicate this, and our consultants are trained to make sure that these signatures are present on each transportation log to ensure accuracy. Next slide, please. No. You're on mute, April.
Thank you. I'm going to pick up from here, and I want to talk first about a little bit, and then I'm going to circle back to it in a few slides, about our Look Again campaign. And so for the last 12 years, we have annually had what we refer to as a Look Again campaign. And because we are a Southern state, we kick this off every May 1st. And so, Alexis, if you'll just play 15-20 seconds of the link video. This is our press conference.
Shaw with the Governor's Office of Highway Safety, and I would like to thank you all for joining us here at Cobb Safety Village for this important message. Today is May 1st, and the National Highway Traffic Safety Administration proclaims May 1st as National Heatstroke Prevention. Good morning, everyone.
Oh.
We are here to raise awareness with the Governor's Office of Highway Safety, and I would like to thank you all for joining us here.
Sorry, guys.
It was just playing double. So it's actually linked in the presentation, and it's on our YouTube channel, and you guys can watch the whole thing. I think that piece of it is 12 minutes, and then there's.
I'm Angel Upshaw with the Governor's Office of Highway Safety. Good morning, everyone.
You can go on to that one where there's not one. Yeah.
Thank you.
So every year we We do that in conjunction with several agencies, state agencies. The governor of Georgia is involved. Our commissioner, Amy Jacobs, is involved. And then we, of course, are sending reminders throughout our warm months, which, of course, here in Georgia go into October and sometimes November, because we know that children left on vehicle, that it doesn't have to be like an advisory like Jan talked about earlier, that happens. And so what brought us to the Look Again campaign? And so I thought it might be important and that you guys might be interested in just hearing our history in Georgia. So in the summer of 2011, and you can see the Georgia code that is here, DECAL received the authority legislatively to emergency close a child care program. This had already been in the works through our legislative session. Our our state fiscal year runs July 1 to June 30th. And so it had passed, but we were waiting for the law to go into effect. We actually had an incident of a child left on vehicle that passed away on June 20th. And so we were awaiting the law to go into effect. And that was the first time. It was the first child death in a vehicle I had experienced here at DECAL was that, and we actually used the intended emergency closure process. And what that statute does for us is we are given 21 days to conduct the investigation, which I have learned and continue to learn, and to say 21 days is not enough because it's calendar days. And we don't have much information from medical, especially autopsies, if there is a death that results, but it's what we have available to us. And then on or before the 21st day, DECAL has to make the decision on what is our next action to the licensed childcare program. In this case, in 2011, we issued the emergency closure July 1 or shortly thereafter. And then within the 21-day period, we revoke the license. If we issue a revocation of license, the program cannot reopen during any appeal period while it is awaiting to be heard in court. And so that was our first experience. We use intended emergency closure very sparingly here in Georgia. Typical years, we use intended emergency closure less than 5 times, but I would say we probably lean more to 2 or 3 in a fiscal year where we use it. And of course, I wanted to just share it because the first time we did use it was death of a child being left on a vehicle. They went on a field trip that was not planned, that parents did not give permission to go on, and the child was left. In Georgia, we also here at the Department of Early Care and Learning have the ability to revise our rules and regulations that does not require legislation. And so over the years and talking with other states at NARA, the National Association for Regulatory Administration, roundtables that we participate in, other states don't always have this flexibility in their rules and regulations. Many of them have to go through a legislative process, but for the rules and regs, we don't. We have a rule change process that is a 6 to 9 month process, which includes public comment, a public hearing, and then our board votes on them because DECAL does have a board. But some of our rules and regulations, if I can just step through those, in 2012 is when we added a required second check of the vehicle at the end of every trip that Brittney talked about. And then since 2012, these other examples I'm going to give you is we go in and just finesse the rules to change them, reword them to make sure that they are in the best state of ensuring children are healthy and safe if they are followed. In December of 2015, we added a biannual transportation training for any staff member that participates in transportation. And this would include checking the vehicle when it arrives at the program. And so they may not be on the vehicle physically when children are being transported, but they are a part of that process. They have to do this biannual training, and we provide that training for free. There are some other trainers. We have a training approval process here at DECAL that folks go through, but that is required for any staff member who participates in the transportation process at a program. And then in June of 2017, we implemented our compliance and enforcement system. And I'm going to step through that a little bit in a few slides, just to talk about what we have at our discretion and what we can use when the transportation rules or other incidents occur in childcare programs. Next slide. So over the last 3 fiscal years, and I told you guys the dates that our fiscal years run, we've had 10 reported incidents of child left on vehicle each year that were investigated. And just like Jan shared with us, we started tracking this, and then it became evident that we needed to track if they were being intentionally left, because what we were seeing is staff person driving would go to pay for gas in a gas station, a child would not come out of a school that they were doing pick up and drop off at, and they would leave a vehicle of children and go into the building to look for a child or whatever. And so a number of years ago, I started tracking it by were children being left intentionally or unintentionally. And so we have that. Also, what is interesting to me, I am a data person, and is when we have an incident of child left on vehicle, often in the investigation, what we see is something has changed in the routine, meaning it's a new driver. We've had multiple incidents where a driver gets a phone call that something has occurred with their own children, a family member, or something, and they are distracted. We have had a couple of times over the years where children, because it especially happens pick up and drop off from public schools coming to the child care program for after school, is that something in the routine. And we've had a couple of times where they've had parties, like Valentine parties, Christmas parties, end of the year parties, and children have stuff with them. And it disrupts just the getting on the vehicle and getting off the vehicle in some way. That our investigations have found that, which I found very interesting, is just, how I see it is, it is a disruption in the routine that typically happens. And so if and when our investigations are substantiated, oftentimes they are self-reported. Programs in Georgia are required to report missing children to us. We consider children left on vehicles as missing children. They are likely to receive an enforcement fine. But as Brittney explained to you with the core rules, most of the transportation rules that would be cited for a child left on vehicle are going to carry an additional weight. If during the regulatory visits that have already occurred in the 12-month look back period, if they've been cited for some of the paperwork things, that they didn't document a first check and a second check, that their signature missing and things like that, the action could be more progressive. So it could be a fine that they get if the child is left on the vehicle, no injury or medical was received as a precaution. Of course, if we have an injury or a child death, we are going to look at that seriousness of that, that severity of that, and make a determination on what action to take. Next slide. And this is our compliance and enforcement chart that I talked about that we added into our rules 9 years ago. We did it for a number of reasons, but programs kept coming to us and saying, we don't know when we're going to receive a fine, a restriction, a suspension, a revocation from you guys. So we had a group that worked for 2 years to come up with this chart. It is a bit complex as it looks. And so the yellow, what is shown on the left-hand side in yellow is the violation class. And then the violation history level is across the top. And then the levels you see in the 3 different shades of blue on the screen is where we are going to look with the number of points and the severity level, the highest severity level of something that has occurred or at the end of an investigation where they intersect. And so often if it's an isolated incident of a child left on a vehicle, they are going to land in C1, which is I1 to I2, which is a fine or a per rule fine. But if we have something more severe to happen, a child is injured, a child death or something like that, we are likely going to assign it a severity level of extreme, which you see is an I3 to C. And I'm going to step through those, but let me give you an example that's not vehicle related. Just to help you understand how we approach our severity levels. I use a scissor example all of the time for how we approach the severity of our core rules that Brittney talked about. And so a pair of adult scissors being out in a classroom can be harmful, but if they're not being touched by a child, we are going to consider that low harm. And so at the point that a 3-year-old touches that adult pair of scissors, the risk has changed to the child, the risk of harm has changed, and so that would move it to a medium level. The 3-year-old is handling the scissors, cut themselves, has to get a couple of stitches or glue to fix the cut on their finger. That's going to be a high harm. And just say that 2 3-year-old children tussle, fight over the pair of scissors. One wants it, the other wants it, and they go in. One of the children gets poked in the eye with the pair of adult scissors and has permanent sight loss as a result of that incident. That's when we're going to consider it a higher severity and likely move it to an extreme harm. So I just wanted to pull it out of the context of vehicles and what we were talking about, just to give you a broad, because lots of things happen in childcare. Childcare is busy. And the vehicle and the transportation process is important, but most of the time and most of the day is not spent on vehicles for most children. Next slide. So the range of action that I was talking about in the C1, that this is, as I said, we put this into rule for a transparency sense. And so the far left column is prevention category. And so that just may be a citation. And typically, if it's a citation in the low, medium, severity levels or a non-core rule, they're just going to get the citation. We expect correction. They're going to have a plan of correction, a date to correct. And then if it is a high harm citation or an extreme, as I said, or if they have repeated the rules. So I gave the example of if on a previous regulatory visit, they had been cited for not completing the checklist, and now we have a child that was left on the vehicle. Depending on how many repeat citations and the severity level, they will fall somewhere in the intermediate category in the middle to the closure category. And so intermediate, we have available to us fines, per rule fines, per day fines, fine and restriction, emergency monitor, short-term suspension, and then as you move into the closure category, suspension of more than a week, revocation of the license, and then emergency closure that I shared, which shows imminent harm. What I did not say about the emergency closure is Childcare Services is a part of the Department of Early Care and Learning, and we, along with our managers, our investigators, our consultants who conduct the visits, and our legal team will decide on the action, anything greater than a per rule fine. However, emergency closure requires the commissioner's approval. And so what we typically do is meet internally, talk about the incident, talk about the investigation that we have thus far. If we, the leadership team and our legal team, have the recommendation of emergency closure, we then make that recommendation to the commissioner, and that is the one action that she has to sign off on. Right now, everything else has my signature on it. I'm the signatory for childcare services, but that is the one thing that that she has to approve and to sign off on. And that was part of how it's written in the statute for that. Right, next slide. Okay, so now I'm circling back around to our Look Again campaign that I talked about that we started in 2013 after the death of a 2-year-old child that was left after a field trip. It was tragic. It impacted us. And we have done it ever since. We have t-shirts, we have decals, we have posters, and we approach it. Every year we try to change it a little bit, but the message is the same all of the time. And what we have found over the years is that we started it for childcare, right? So children that are in licensed exempt childcare in the state of Georgia are not left in vehicles. However, this campaign in Georgia over time has become Look Again regardless for any caregiver for anywhere children are present, whether it's, church, parks, malls, etc. It has become a campaign across the state and across, not just for childcare. So we have a great communication department that runs our social media websites and handles our Look Again campaign. And they come to us. Reg always comes to me and asks for the data. And I'm like, give me a second. It's not the end of the fiscal year. And I go and do it because we do keep that on a monthly cycle. But this year, our communications team worked and received a grant from the Georgia Office of Highway Safety for $30,000. And so this year we've actually added a layer to our campaign, and hopefully that we will be able to work and do this in coming years where we have added billboards across the state to remind everybody of the Look Again campaign. And again, it's become a statewide effort and not just childcare. Next slide. So these are the 4 images that our communications team worked on. And as you can see, it's got our logo, but we don't say, don't leave kids in vehicles or childcare. It is a universal message that we are trying to get out in the state of Georgia. And next slide, Alexis. And then here are some of the 13 billboards across the state in real life that are posted, and they are still up. We are probably the last 2 weeks, as we were chatting yesterday via text, probably the hottest 2 weeks that we've had, and it will probably remain for us very hot in the 90s through August here in Georgia. And so I just wanted to share that with y'all, and Brittney and I can take any questions, and if we can't answer it, some of our other directors are here and they can help us, but we're happy to answer any questions that you guys may have.
Wonderful work. And your team is quite a team. I've been working with you guys for a very long time. I met Reg a while back, so bravo. And I love how you are able to do internal facing with childcare, but then you've made this a bigger campaign where it's external facing for your whole community within Georgia. So that's wonderful. Thank you very much for sharing everything. I think it's also really nice to be able to see on a high level how your regulations play into your rules and roles with the childcare centers to help us better understand how that whole process works. So thank you. We'll open it up for any questions. Does anyone have any questions for them? Anything in the chat?
Hi, this is Amber with Kids in Cars. I was wondering if you guys would be able to share with us the details about the incidents that you've documented where children have been left.
I like right now.
Well,
Most-
no, but
Most of it,
follow up with-
the 10 incidents that I reported for the last couple of years are often before after school transportation. And either because they are school age children, they get off the vehicle on their own, or a parent is arriving for pickup just in that transition of the afternoon. Because, the afternoon parents will come from 3 o'clock to 6:30 for most typical programs. And so sometimes it is that. We have not had an intentional left where something happens, but we consider it a child left on vehicle because it's inappropriate to leave a child unattended on a vehicle by our rules and regs. And so, but if you wanted more specifics, I can get you that and share that with you. And then, of course, if you wanted even deeper through an open records request, you could get the entire investigation on how we approach those. But most of them, I would say, that we have are child left after a field trip or before and after pickup.
Okay. Yeah, I'm definitely interested in like more of a detailed report because we collect data on that and I want to make sure that we have all of those cases in our database. So I'll reach out to you though separately. I just wanted to know if it was possible for you to share.
Just reach out to me and let me know and we can chat or have another call. FYI, I'm going on vacation starting tomorrow.
Yay.
So when Alexis asked me, and then I was like, I can't do that day, but I can do the day before. And so, but I'm happy to help, Amber.
Awesome.
And if there are questions while April is out,
Yeah.
of course,
And-
I'll be more than happy to answer anything and respond. So no worries there.
Does anyone else have any questions for April or Brittney? Well, thank you very, very much for
Yes.
coming and sharing your information. And it was very, very helpful. So
Yep.
Have a wonderful vacation. Enjoy yourself. And thank you very much.
Thank y'all. Have a
Bye.
good one.
Bye-bye.
Okay. So we had the Q&A. I want to be able to share something with you that's very exciting. Here is our MedFair tray cover. We've been working on this. This is a partnership that we have with MedFair that was established before I came on board. However, the tray liner, they sell within hospitals throughout the United States. And so on the right-hand side, if you are in a hospital or if you are interested, I have the information. But on the tray liner, it has the video of a parent who lost a child. And also too, there is the QR code for Children Hot Cars for folks to take the quick 10-minute learning module that we have. So this is available. They're also too donating 1% back to us to be able to support PVH. So this was really excited. This came out. The next is, I want to share with you about the subcommittees because you guys have been working really hard. So before I would like to be able to thank Maureen Johnson. She stepped in a year ago to be able to oversee the communications subcommittee and has done a phenomenal job with some of her team members, which I see are on the call today. So thank you. They developed an employee-employer toolkit, and they're currently working on disseminating that out even further with their contacts. So that is located on the cpsboard.org website. And if you would like to be able to participate, we'd love you to send it out to your businesses that you have in your community or even your own employer to be able to have those tools to talk about PVH. So Maureen, thank you so much. But in that said, the chair position is open, and I'm sure Maureen would be more than happy to share with you if you're interested on how her experience was this year and how much time that curtailed. So thank you very much, Maureen. So if anyone's interested, please reach out to me. That'd be great. Also, too, I'd like to thank Laurel Glenn from the Virginia Tech Transportation Institute. She has stepped in for the state Task Force Development Subcommittee, which is putting together a technology and research library. So coming up with the criteria and being able to decide how we're going to post all of technology, let it be in vehicles, car seats, aftermarket, or we're doing a whole thing with childcare, with software, and also aftermarket for vehicles. So she is working on that. I'm temporarily in the Policy and Legislation Subcommittee. We're working on a childcare project. We met this past week, and we have put together an assessment questionnaire. And we've been very fortunate to be able to link up with the state of Virginia, who will be sending out this questionnaire to all of their childcare centers. So it's good, better, best, or NA. So what this questionnaire is going to do, it's going to evaluate where what childcare facilities do as it pertains to children being left alone in the car, or talking about educating their staff, educating caregivers, or transportation needs. So we're going to be sending that questionnaire out. That questionnaire is going to be the basis of a best practice guide that we are going to roll out as a committee. And so we'll go from there. But Amber has played a big role in being able to weed through how we are going to get the childcare program rolling. So thank you very much, Amber. I see that you're on. So thank you. So we're working towards that. The goal is that we know that we're committees that have a lot of other work that we're doing. So this is slow go. The vision would be is to be able to get this childcare packet project and also to the technology and research library ready to hit the roads first thing next year. This is a process of bringing in a lot of information and working collaboratively underneath one umbrella. We don't want to duplicate. We want to be able to provide a valuable resource. I do have to say that there was one fatality in Ormond Beach, which was 5 miles away from my house. It was horrific. It was a parent that intentionally left their child in the vehicle, 18 months old, to go in to get a haircut and go to a local bar. And the child was in the parking lot, I think around 3 hours. And then he decided to bring the child in the car seat home to his mom and then call the police. So from that, I really struggled a lot with thinking, how can we make a difference? And I came out, I've been thinking that bystanders are the key to stopping this. The parents are going to do this behavior. You saw that the numbers are up, but the bystanders are the key to being able to call 911 and get that child out of the vehicle. So that said, I'm going to start working on some assets for a bystander campaign. I'm meeting with the chief of police for Volusia County because this is where the incident happened. And then I'm meeting with a group of individuals the following Monday for a Safe Kids Coalition meeting. And I'd like to be able to start thinking about piloting a bystander campaign and getting that out, because I really think that bystander campaign, and I don't know, and if you guys want to chime in too in the comments, that'd be great. But bystanders, I think, are where it's at. I also think outside of PVH, any child left unattended is a not good thing either. So that's the direction of all the subcommittees. They're all working hard. I know you guys all are busy. Anyone that would like to participate more, please give me a call, jump on. I always love sets of eyes to be able to look at the materials that are being developed. So, and I hope that all of you know that the things that we create is something that we do together as a team. So Maureen left her information, I see it in the chat for all of you. Our next meeting is going to be October 14th. So this is somewhat at the end of our hot season. So anyone would like to do a presentation for the group next quarter, please reach out to me. I'm trying to be able to get information that we haven't had before. So with DECAL, seeing how on a state level they work together and they partner, I thought was real important, looking at how the regulations and policy work. So that said, I wish you all a wonderful day. I think I gave you 9 minutes back in your day, which I love to do. And so we'll see you in October. But if you have any questions or want to jump in to be able to support some of the subcommittees, please reach out and give me a call. Thank you. Have a great day.